So yesterday I posted a week 2 Strattera update, and today I wanted to kind of elaborate on a couple of things, some symptoms that I forgot to mention, and I figured I'd do it now before I forget again. So for those of you who don't know, I am taking 60 milligrams of Strattera for symptoms of inattentive ADHD and anxiety. I also have major depressive disorder and cerebral palsy. Although I don't know if Strattera really does anything for the depression part of it, but right now I'm mostly focused on treating the anxiety and symptoms of ADHD because I will be going back to school in the fall and I want to learn to drive, and I've realized that the ADHD and anxiety symptoms combined are a big part of what has kept me from learning how to drive. Anyway, so some additional symptoms since I have been taking Strattera: dry mouth throughout the day, not a big deal, but just something to be aware of. And also, something I mentioned previously, lack of appetite. I'll take my capsule in the morning with breakfast, have a full breakfast, and then shortly after, I just won't feel hungry at all, and it'll stay that way for the rest of the day. And I'll have to remind myself to eat because I just don't get hungry. And along with that lack of appetite, um, shortly after taking Strattera, I do tend to get a little bit nauseous and feel a little weak. So sometimes I'll have to lie down for a bit. And it's not like really, really bad. I mean, it's tolerable. If you've been following my mental health journey, you know that this is about the fourth medication that I've tried. And previously, before Strattera, I was taking a mood stabilizer known as lamotrigine. Actually, before Strattera, I was taking Wellbutrin. But before Wellbutrin, I was taking the mood stabilizer lamotrigine, and it caused me to have horrible, horrible nausea to the point where I was vomiting my guts out every single night for 3 weeks until I just decided I was just not going to take it anymore. So then after that, I took Wellbutrin, which went pretty well the first couple of weeks, and then I got a really bad rash. So I've always had kind of extreme symptoms when it comes to medication. I've always had some sort of extreme side effect, whether it's a bad rash or daily vomiting, or I think the most mild was with Zoloft, which caused me to gain over 30 pounds in a period of 8 months. So anyway, all of this to say that the mild nausea that I do experience shortly after taking Strattera is nothing compared to what I was experiencing with the mood stabilizer that I was previously taking. So it's tolerable, not a big deal. And then the third side effect, it's really kind of two things combined. So emotional blunting, meaning I don't necessarily feel happy, but I also don't feel sad. Just I'm kind of like blah. Um, it's kind of difficult for me to feel any emotion, even anger, which I guess is not necessarily a bad thing that I don't get angry, but it's that way with pretty much every emotion, kind of like I'm emotionally numb. And with that, also, I experience brain fog. It's difficult for me to focus and concentrate on things, and I just kind of feel like I'm running around on autopilot all day long. And brain fog, at least mild brain fog, I think is something that just goes with having ADHD, kind of the nature of the beast, along with the inattention. But I do think that it has definitely increased. The brain fog has definitely increased since I started taking Strattera, particularly this last week. but I am hoping that that is just temporary. I'm hoping that I won't have to deal with the nausea or the brain fog or the emotional blunting forever. Um, I haven't experienced any significant improvements in my ADHD or anxiety symptoms yet, but the my provider does say to give the medication 4 to 6 weeks before before I can feel its full effect, kind of give it time to do its thing. So I'm really hoping that that'll work out. So I'm just being patient and dealing with these kind of mild side effects. I mean, they're a nuisance, but they're not bad enough for me to say that I'm just going to stop taking it. Because I really want to give the medication a chance to do its thing before I decide whether or not um, I want to stop taking it. But I'm wondering if my provider maybe started me on too high of a dose because based on other research and YouTube videos and things that I have watched and read, a lot of people start on low doses, like 13 milligrams or 25 milligrams, and my provider just kind of right off the bat decided to start me on 60 milligrams of Strattera daily. So I'm wondering if maybe the dosage is too high, and if I go to a lower dose, it might uh, might help with some of the side effects. I'm not sure. I'm not an expert, but it's something that I think I'm going to discuss with her in our next meeting. But anyway, yeah, so those are the symptoms I wanted to kind of discuss. It was the dry mouth, the lack of appetite and nausea, and the emotional blunting and brain fog. I will be back next week with another update.